This is the procedure for administration of a metered dose inhaler. Before administration, make sure that the metered dose inhaler is at room temperature and that the counter shows that there are adequate doses in the metered dose inhaler for the procedure you're about to perform. Next, you should shake the MDI vigorously for as long as the manufacturer recommends. If it has not been used in the prior 24 hours, or if it's new, prime the MDI, generally by actuating it into the air. Then select an appropriate patient interface.
So I have two holding chambers. Holding chambers have one-way valves in them, spacers do not. So I have two different kinds of holding chambers for two different kinds of patients. The first one is an aero chamber, very commonly stocked in respiratory departments. The pediatric and the neo aero chamber have a built-in mask. So what you would do is, after you've shaken your MDI, you can put it into the back end of the aero chamber, and I'm going to pick up baby here and shake, and then you apply to baby's face like that. So that would be the appropriate interface for your patient. For adults, you might find a holding chamber more like this at your institution, with no kind of patient interface. If your patient's alert and orientated, can follow directions well, go ahead and use this as your mouthpiece. You don't need anything more. If your patient is unable to follow commands, you can still use an MDI, and your department may have a mask that looks like this in different sizes for your patients. And what you can do is just slide that on the back end, and then you can administer your MDI to your patients who are unable to take a slow, deep breath in. So because I'm going to be demonstrating an alert and orientated patient, we'll use a holding chamber and the mouthpiece. So I've shaken and I've put in here.
So actuate the MDI, instruct the patient to take a slow, deep inspiration, and then attempt to hold the inspiration for 5 to 10 seconds.
Okay, so I'm going to actually exhale just a little bit to make certain I can take a nice big vital capacity in. So I've shaken, I exhale, I put this in my mouth, and then you will see me depress and actuate the medication.
If you hear the chamber whistle, the patient's inspiration is too fast. So instruct the patient to slow their inspiration down if there are further puffs being administered. Wait at least 1 minute between actuations and repeat that inspiratory procedure until the number of ordered puffs has been administered. When administering a corticosteroid, instruct the patient to rinse their mouth with water and spit into a basin or sink. They should not swallow the liquid.